Hello and welcome back to Hogue Health. My name is Mona Cabrera and I'm the registered dietitian of the lifestyle program out here in Foothill Ranch, California. I want to welcome you guys all to Nutrition Topic Tuesday. It is a really wet day today, so I hope you guys are all staying dry and warm inside. I want to thank you guys all for joining. If you're new to our channel, please let me know where you are tuning in from. I'm gonna have the live chat down here, so if you have a comment, a question, anything you wanna say, please put that in the live chat. Happy to chat with all of you joining me live. So the title says how to manage weight loss plateau, but we did do a same topic about 3 months ago, so you can search that in the playlist Healthy Lifestyle here and find that. So I'm going to be talking about something else today, and hopefully it's a topic of interest to you. So before we get started, if you're new to the channel, say hello and welcome. If you hit the subscription button below, the bell, that will give you notifications when we're coming on live. And we have exercise classes, we have food cooking demonstrations here. Every Wednesday at 2 o'clock I come on and make an easy, healthy recipe for you because we're all busy, but we're trying to eat healthier. So if we have those easy recipes in our back pocket, it will make it easier for you. So that's what I do on Wednesdays at 2 o'clock. Rebecca has classes in the morning on Tuesday, Thursday at 9 a.m. and Dan has a class Thursday at noon for you. So, and they're all recorded and saved here on our Healthy Lifestyle playlist for you. So, what are we talking about today? We are talking about menopause and type 2 diabetes and the risk and the link between those two. Lots of our patients here in the lifestyle program are perimenopausal, menopause, and postmenopausal, so I thought this was a great topic. And if you're not yet there in the stage of life, it is good to know these things so you can work on them before you hit menopause. It's so important to work on all these things before we get to that stage in life. It's going to help you so much to prevent that diabetes, type 2 diabetes. So what you eat can really decrease your risk of diabetes during menopause. So when we think of menopause, what do you think? Slower metabolism, moodiness, some belly fat, visceral fat coming on that you may not have had all your life, hot flashes, waking up in the middle of the night drenched in your sweat, in your sheets, right? So these are all very true and they do happen. And there was a study done in 2019 that showed that 13% of postmenopausal women do develop type 2 diabetes. So it's a lot, and we should be aware and practice now to prevent this. So especially if you're in your 30s and 40s and you're not perimenopausal yet, it's really important to know this and start practicing these things. So what happens during perimenopause is that our estrogen, our hormone estrogen levels decrease. So we will no longer ovulate, and then we no longer menstruate. And so as the estrogen goes down, decreases, that makes us more prone to insulin resistance. Maybe you've heard insulin resistance before. Maybe you've been to the doctor recently and had your blood sugar checked, and they mentioned you are insulin resistant or your blood sugar is a little high. So the estrogens are involved in this insulin sensitivity and the signaling, so it does put women at a higher risk at that later stage in life. And then we do see the weight gain, usually around the belly area, right? In that belly area, that stored fat is your visceral fat. So with increased weight And that inflammatory fat storage that's going on can lead to type 2 diabetes. And during this time, menopausal years or even postmenopausal years past 40, women become less active, right? We are raising our family and really focusing on everyone else's needs and working full time, what have you. We become less active, going through midlife. And what happens is with that less activity, our muscle mass decreases. And so as a result, we do have a slower metabolism. So less muscle mass, the metabolism is gonna go down because muscle mass, having that muscle is really burning that fire all day long. So that metabolism, right? So as your muscle mass decreases, your metabolism decreases. So both of these things will, can worsen insulin resistance. So we have a lot of things going on. So you're gonna become insulin resistant and then you have a higher risk for diabetes type 2. So I hope that makes sense to everybody. Okay, I'm just gonna pull up the live chat. Hi, John from Costa Mesa. Thank you for tuning in today. Okay, so that was just a little explanation about insulin and estrogens. So what can we do to prevent or decrease our risk of type 2 diabetes, especially menopausal and postmenopausal? A lot of things we can do. So let's just go through some of these. So you do want to focus, and we're going to talk about diet here. You do want to focus on keeping blood sugar stable. And how do we do that? We do that by eating a diet rich in fiber, high antioxidants, and protein rich. We also do that by managing our stress levels, also getting enough sleep, usually about 7 to 9 hours of sleep, and getting regular exercise, some kind of movement every day. And I do encourage that strength training and that cardio in terms of exercise. So the strength training is going to keep your muscle mass and build muscle. It's recommended to get strength training 2 to 3 times a week. And then cardio exercise, any kind of movement that gets your heart rate up every day. And really finding what you like for that cardio. Because if you don't like it, it's going to be really hard to sustain something and do it every day. And what really helps to use that blood sugar, so we're trying to stabilize our blood sugar to prevent this type 2 diabetes, is doing an exercise after meals. So if you can get in a short walk after lunch, maybe a 10-minute walk, especially if you're out in the office or something, and then getting some kind of walk or exercise after dinner. It's going to help utilize that blood glucose, that blood sugar that is in your bloodstream. And we are more insulin resistant in the evening when our body is slowing down. So if you can get some kind of exercise after dinner, whether it's walking or you have a treadmill or a stationary bike, or you like to dance, or maybe you're going to do your strength training in the evening. There's all types of exercise, but really finding what you really enjoy, that brings you joy, because then you'll stick to it. So if you do what I do, you might not like it. So really finding what you enjoy and really sticking to that is really going to help utilize that blood sugar. We talked about sleep really helps balance blood sugar. When we are sleep deprived, we are always looking for sugar to give us that energy to pick us up. So when we're sleep deprived, it's shown that we do eat more and pick less healthy choices, something more with sugar. Okay, and then minimizing stress, really better stress management skills helps blood sugar as well. And there's always going to be stress, so it's finding ways to manage your stress. So let's talk about that diet for a little bit, because all of these things are going to help affect and help manage your blood sugar. But I want to talk about the diet. I mentioned a high fiber, high protein, antioxidant rich diet. What does that mean? So colorful diet, lots of vegetables, lots of fruits, a couple fruits a day. If you can have vegetables with every meal, really pushing up our fiber, because most Americans don't get the recommended daily amount of fiber. For men, it's 38 grams a day, and women, it's 25 grams a day. So really increasing the fiber at each meal. And you'll also get fiber from eating whole grains and legumes, beans. So those are other sources of fiber as well. So really incorporating those into your meal. So for example, I'll just give you some really easy, let's say it's a breakfast. It could be a cup of Greek yogurt with no sugar, cut up apple on top, a handful of crushed walnuts, and that could be a little breakfast. Maybe you're doing an omelet, 2 eggs, bunch of spinach thrown in there, and a whole grain toast with avocado. Maybe that's a different breakfast. So you can see there's a lot of color thrown into those meals, lots of protein. So we can keep our muscle mass as we age and grow muscle by that strength training, when that protein is really gonna help. So that's just a sample of a breakfast. Maybe it's lunch. Maybe you usually have a sandwich, but there's no colors there. There's no vegetables. Maybe putting some lettuce and tomatoes or spinach in your sandwich and having an apple on the side. So those are ways to throw in some more fiber. So I want to talk about some foods that you can incorporate that have shown in studies to really have these properties that help fight type 2 diabetes. So the first one is walnuts. Walnuts are a nut very high in your ALA omega-3 fatty acids, and it's a high fiber nut and a plant-based protein. And these polyunsaturated fats in walnuts have really shown to help various cardiovascular metabolic factors, those help reduce risk of type 2 diabetes. So if you have, let's say, Greek yogurt, like I said, or a salad, or a yogurt parfait, sprinkling walnuts on top, you can incorporate walnuts into your diet. The next food is lentils. I love lentils. They are so high in fiber and so underused. Lentils, plant-based protein, high in fiber, high in antioxidants. If you don't want to make a pot of them, buy them already cooked in stores. You can find them in packages, or you can find them in a can. So those are easy. So it's easy to get lentils in your house. You don't have to cook them, but still get the benefits. Throw them on a salad, use them in a meal. Maybe you're making lentil soup, lentil stew, what have you. So there's lots of benefits from using your lentils. And lentils have a lot of anti-diabetic properties. So that's another food. The other food I wanted to mention was a fish. So our oily fish, salmon, really important, excellent source of protein and an excellent source of omega-3s and DHA. And these have shown to decrease our risk also of type 2 diabetes. So if you haven't been eating fish, you can keep it really easy. They sell them in frozen packets that I like to do. You can pull out 1 to 2 packets depending on how many people you're feeding. And using your skillet really takes 5 minutes on each side of a piece of salmon. Maybe using some garlic, some lemon, and just maybe Italian spices. Keeping it really simple. You don't need a lot to make it really delicious. And then you can have a salad with lentils on top, and maybe another side vegetable like asparagus. So keeping it really easy, nothing fancy, but still getting these healthy foods on your plate. And the last one I wanted to mention was whole grain cereal, like oatmeal or some kind of bran flake. These have a lot of micronutrients and our B vitamins that are really important, and lots of properties that help decrease our risk for type 2 diabetes. So if you haven't been using oatmeal, I like to use oatmeal over a bowl of Greek yogurt. I've mentioned that a lot because Greek yogurt is such an excellent source of protein and calcium, and it's delicious. So I sprinkle it over my nuts and my apple, and I'll sprinkle some oatmeal on top. But you can enjoy a bowl of oatmeal as part of your breakfast. Some people put oatmeal in some protein smoothies. Lots of ways to use our oatmeal. Some people use oats as making it into an oat flour to make, like, for example, banana bread or something like that in their baking. So lots of ways to incorporate these foods, but really the main idea is really focusing on a very high fiber diet, so lots of colors from our vegetables and our fruit, also incorporating the beans, legumes, and whole grains, and a high protein diet. And then also getting in our exercise every day and managing stress and getting adequate sleep, 7 to 9 hours of sleep. So if there's any one of those areas that you feel like you could do better, pick it and maybe make a little change and set that as a little goal. So if you feel like you don't eat vegetables every day, I like to help my patients with their small goals that they can do every day to change their health. And a lot of it is, how are we going to get those vegetables in our day? So maybe incorporating half a cup of vegetables at lunchtime is somebody's goal because they are not eating vegetables every day. So whether it's a side salad or put in there, the vegetables are put in their sandwich, or maybe they're making a protein smoothie and they throw a handful of spinach in there. So lots of ways. So that's the main thing when it comes to the diet for menopause and decreasing our risk for type 2 diabetes, is really eating that high fiber, high protein diet. So that's a little spiel on that topic. I appreciate you guys all tuning in. There's some comments here. Let's see. So John agrees that lentils are the best. They are delicious. Easy to cook. Okay. Steel cut oats, yes, cooked in the Instant Pot, making a big batch for the entire week. That's a great tip, thank you. And can oatmeal be roasted? Yes, when we make granola, that's roasting some oats. So I don't know what you wanted to do with it, but you can roast oatmeal. Sweet potatoes, absolutely, lots of micronutrients, lots of fiber, great energy source. Thanks for pointing that out. That's a very high fiber, starchy vegetable, absolutely. Lots of great ideas. There's lots of recipes on the internet. You're asking for lentil recipes. I would just, depending on how you want to cook it, if you want Instant Pot lentil soup, that's what I would, Google. You could go to Eating Well. There's lots of recipes there. Okay, thanks for all those comments. Anything else? Any questions, comments? It's definitely a time of life, this menopause. Sometimes we don't prepare for it, and then we're just like, what's going on? And then we're shocked, and we're shocked about our bodies and all the health concerns that come with it later in life, right? So if you're not perimenopause or menopause, practicing all this is gonna help you when you get to that stage in life. And if you are in that stage of life right now, I'm glad you're listening, because these are all going to help you feel your best and really prevent the chronic diseases that can come with it. So that is it for today. I want to thank you guys all for joining. Tomorrow is a very easy pasta dish. I'm going to tell you that. We haven't had a lot of pasta dishes here, and people love pasta, right? We all love pasta. So I am going to show you how to incorporate pasta into a healthy meal, and it's easy and quick and not a lot of ingredients. So it's really a very basic recipe, but sometimes we need the reminders of those healthy basic recipes, because eating healthy, it doesn't have to be complicated. So I will be here tomorrow doing that at 2 o'clock. So stay tuned. And I want to thank you guys all for joining today and for all your comments and chatting. That is it for today. Hopefully it's not going to rain anymore and we can stay dry and get some sunshine soon. So I will see you guys all tomorrow. Thank you so much.